Good evening and welcome to the Atlanta Autism Consortium's free educational outreach program, implementing a statewide telehealth autism diagnostic model in partnership with early intervention, outcomes, and stakeholder experiences. My name is Michael Morrier, and I'm the program committee chair with the Atlanta Autism Consortium Board of Directors. The AAC is a nonprofit organization dedicated to creating collaboration and conversations throughout the Metro Atlanta autism community and beyond. Throughout the year, we host free educational programs just like this on a wide variety of topics. The entire AAC Board of Directors are so glad that you've joined us tonight. Before we get started, just a few brief housekeeping notes. Please note that as an attendee, your microphone and camera will remain muted, but you can ask questions you have throughout the program in a chat box at the bottom of your screen. We'll be saving all questions for the Q&A portion of the presentation in order for the presenters to provide you with all of the material prepared. Additionally, this session is being recorded and will be posted on the AAC's YouTube channel in a few weeks. We will email out notification when it's available, as well as any materials and contact information for our speakers. This information will be sent to the email address you used when you registered for tonight's program. Tonight's presentation is being provided by a great team of researchers from the Emory Autism Center, which is led by Dr. Allison Schwartz. Dr. Schwartz is an assistant professor in the Department of Psychiatry and Behavioral Sciences. At the Emory Autism Center, she is the director of the Diagnostic Core, where she leads up the comprehensive diagnostic clinics spanning the entire age range. Dr. Schwartz's research focuses on early diagnostic assessments for autism, including evidence-based methods for increasing community clinicians' ability and efficacy, as well as protocols to increase accessibility and decrease the age of diagnosis across the state. We're honored to have Dr. Schwartz and her team present on the Early Diagnostic Response Model. And now I pass it over to Dr. Schwartz to introduce the rest of her team and the panel of stakeholders. Thank you, Dr. Schwartz.
Awesome. Well, thank you so much, Dr. Morrier. We're so excited to be here. I'm going to pull up my PowerPoint with me. There are a bunch of stakeholders, and they're the prize of the night. So I'm going to go through a little bit of what the program is, and then they're going to be able to give a lot of feedback and context to their experiences. So let me go ahead and share my screen, and I will introduce everyone as we get started. So again, thank you for having us. We're so excited. This is a lot of our favorite project, the favorite part of my job. So I love talking about it and love hearing questions and comments. So we have a pilot, and it is part of a contract that the Emory Autism Center has with the Department of Public Health in collaboration with Babies Can't Wait. So a lot of the research and the pilot and what we're working on is part of that contract. So today, I'm going to tell you a little bit about what is this pilot that we call EDRM. We call it the Early Diagnostic Response Model. So what is it? What does it look like? We've gone through 2 phases so far. What does the data say? What is it? Is it working? What are we doing? And where are we going with it? And like I said, the highlight of today is really the panelists and the experience, our stakeholders. It's going to include families. I think we're waiting for a few families to join us, as well as Babies Can't Wait providers, early intervention coordinators, as well as service coordinators. We are so honored to have them, spend some time and share their experiences, as well as the Georgia Department of Public Health with Ms. Nita Griswold. So we will introduce them a little bit more formally when we get to that portion. But again, that's going to be the highlight of the night. So with me presenting today is Lexi Edwards. She is a Rollins School of Public Health master's student. She's been working on this project for over a year as part of her work in what we call the REAL program, which is in doing a lot of intake coordination and data assessment and analysis, as well as Rachel Eloy, who's also a Rollins School of Public Health master's student. She has been with me for a little over a year and a half and doing the same They not only work with us as clinicians, but they spend a lot of time working with our families, our early intervention providers, our babies can't wait providers. They're really providing kind of the connection that makes this pilot so successful. So what is this EDRM that I talk about? So just as a little bit of a foundation, we know that the research is showing we can reliably diagnose autism by two a lot earlier, is what we're finding. But we know that, especially in the state of Georgia, that only 47% of kids receive psychological or developmental evaluation, are identified by age 8. So we need those developmental evaluations in order to get identified or diagnosed with autism to often get access to certain services. While that's a whole nother conversation of why you need the diagnosis to get services that will be helpful. It is helpful right currently in the state that we're in. Um, Many families can't get these diagnoses. They're flagged. We see a lot of concerns, but they're waiting on wait lists. There's not enough clinicians. There's not enough resources in their areas, and consequently, they're missing out on specific interventions and specific resources to help the kids, especially when they're like super young, to kind of learn some skills. So what we did, so what you know, Dr. Morrier was a part of it, and Dr. Kathy Rice at the Emory Autism Center helped in 2018 train a whole bunch of early intervention providers. Those are our babies can't wait providers across the state on the MChat, which is an autism screener. So the idea is either to train them to administer it at 18 or 24 months, or to train them to gather the data from the pediatricians and input it. So the idea is that early intervention is up to age 3 so that we can catch some of these developmental monitoring and screeners. So the last data that we looked at was from June 2023 to June 2024. 13,148 children within Babies Can't Wait, so 0 to 3, so about 18 or 24 months, were screened on the autism screener. About half of the kids enrolled, a little more. 4,000 failed. So 4,000 were identified as moderate or high risk on the autism screener, which indicates that they recommended a referral for additional assessment. So out of those 4,000 that were recommended referral, 2,000 were indicated by early intervention providers as needing a referral for an assessment. And out of those 2,000, 846 got the assessment that we know of. So there's a lot of reasons why and a lot of information that we are trying to unpack, but sometimes providers don't make the referral because either parents aren't ready for it or there's nowhere to refer them to, so it's frustrating for them to make a referral and say, I don't know where to send you. So we know that there's a need. We know that in early intervention, excuse me, that within Babies Can't Wait and early intervention, that these children are already identified as being delayed developmentally and already kind of struggling in some of the areas of development. So we feel like this is an ideal place to kind of help support early screening and assessment. These Babies Can't Wait providers, they follow a naturalistic model. They're in these families' homes. They're meeting with them quarterly, if not weekly, depending on the providers' kind of what their job is. They have relationships with these families. They support them in ways that they need to be supported. These families trust these providers. They listen to them. They can meet with them several times and say, look, we see these ongoing concerns as well as these screening results indicate a referral for additional assessment. And what the research has shown is that these providers want to participate. They want more training. They want to be a part of screening in autism. So we targeted this. We knew the need was there, that a lot of kids were being identified as needing an assessment, but not able to get it. And we also know that Babies Can't Wait is a great partnership and collaboration to be able to kind of support these families. So again, this is the Georgia Autism Plan, the RAISE. So the yellow is what Babies Can't Wait is already doing. And again, they do some other stuff like community supports, of course. And then we want to come in and help also help with the diagnosis piece, and then help with Babies Can't Wait and supporting the family post-diagnosis. So what is phase one and phase two? So in general, within this model, what we wanted to highlight is not just a assessment model. We wanted to highlight, does it work with this collaboration? Can we better support families by collaborating with Babies Can't Wait and kind of not just diagnosing them, but like handing them back to Babies Can't Wait for additional support? They don't just walk out of our clinic or off our screens and then try and figure it out. They're going back to kind of what we call a warm hug, and Babies Can't Wait's there to help them and help them interpret the diagnosis and access services. Um, we took kind of some of those elements of Babies Can't Wait and that collaboration and that support, and we incorporated what we call family navigation. I've heard it called concierge services, where and I'll tell you a little bit about that too. So again, the Babies Can't Wait onboarding is we reach out to them. If we don't need Babies Can't Wait, then we don't reach out to them. They still get the final report. They still get emails knowing where the families are within the process. But if we can't get in touch with the families, we will call them initially, like, we're having a hard time. There's been incidents where they're able to share, look, this family's going through their own trauma, or they have moms changing jobs, and we've been able to kind of work with them knowing that information. There's been times when they've helped with insurance. We just recently had a family that was having an insurance issue, and we were able to work with the Babies Can't Wait, and the service coordinator really went above and beyond to sit with the mom on the phone with insurance, and help that family get that taken care of. There's times when families don't have access to telehealth, and this is a telehealth model. And Babies Can't Wait always provides a space and technology in order to the families to still access the service. So whether or not they come to the home or they bring them to their office, they are there to collaborate so they're not missing out on this assessment and opportunity. And then again, like I said, the post-assessment resources, Babies Can't Wait has been invaluable into, again, that warm hug and helping them access services, including insurance waivers, and then transitioning to the school system with the right diagnoses and the right kind of understanding of the child. So, what is family navigation? So again, like I said, we kind of took these principles of Babies Can't Wait and this naturalistic support, and we embedded that into what Lexi and Rachel and the rest of the intake coordination team does at the Emory Autism Center. We try and guide and assist families through this process. Family navigation is a formal kind of research-based program to get families the right support so they can overcome obstacles that are often in these healthcare settings. So what we make sure that our intake coordinators do is they receive ongoing training. We meet every week. We train them on resources. We train them on what is an autism assessment, how to talk to parents, how to answer questions. We talk about reviewing of cases and what to do next, and how to best support them. And a lot of that talk is when to reach out to Babies Can't Wait, and how to include them. Um, they provide families with a lot of information, a lot of resources, assistance to education, and education to like kind of what it's going to look like. So it's not just, okay, we schedule you for an autism assessment. They really talk it through with the families. You're going to show up and there's going to be a psychologist on the other end, and she's going to ask you to do X, Y, and Z, and she needs you to get these things ready. They try and really work with the different needs of the family, whether it's cultural, whether it's socioeconomic, whether it's rurality or urban. We have a lot of families that, face lots of different challenges due to their individual needs, and we really try and adjust our support according to that. They really have that connection. So these are not just a scheduler at an office. These are providers that really try and connect families and connect services between Babies Can't Wait and assessment. They go above and beyond often. These are relationships with families, and I'm sure you're going to hear this from families today. They really try and show empathy and compassion. Our families are are working hard. Just like everybody here, they have multiple demands on them and multiple challenges. And really, this family navigation team tries to meet them where they are, understand, be flexible. Often they're doing these consents and supporting intakes at 6 o'clock at night, at 8 o'clock at night, at 6 in the morning, if that works with the family. They're reading the questions out loud to them. They're helping walk them through them. Again, these aren't supports you're going to get always at a community clinic because they just don't have the capacity to do it. And then lastly, we really try and help coordinate services. Often that's the connection with Babies Can't Wait because Babies Can't Wait just knows their community and resources best. I don't pretend to know every resources in the across the state. So that's where we really rely on Babies Can't Wait. But more often than I would like to say, we've had families come back with, well, my other sibling, a sibling of the child needs an evaluation. Or we had one family whose sibling had evaluated, but they could not get the right documents from the psychologist. So we were able to connect them with another psychologist and get that child what he needed in order to kind of proceed with his intervention. So really supporting these families, not just during it, but after as needed. So what is in general phase one and phase two? We did have eligibility. Children have to be enrolled and Babies Can't Wait. Um, for this pilot right now, there has to be a high risk fail. So on the MCHAT, the autism screener, a 3 to 7 is a moderate risk fail. Anything an 8 or above is a high risk. So out of a total of 20. So these kids are a high risk fail. Um, they need to be completed within the ages of the MCHAT. We want the child to have some exposure to English. That just means someone speaking English in the home. And parents do need to be able to do interview and complete forms in English. And like I said, they need access to the internet. Some of these we're able to kind of support as needed, for example, like the internet. I will also say that I shouldn't say it. Sometimes we make exceptions for families. So when a family comes in and I see Kyra's here from Columbus, and when she calls, oh, Allison, I have a family that really needs help. They're 34 months, they're 34, they're about to age out. We have a hard time saying no to our families. So we do our best to support them where they're at. So what was phase one? Our questions in phase one of EDRM phase one is, does it work? Do psychologists and the providers and the families, do they like a telehealth assessment? So we started this in June of 2022 at kind of the end of the pandemic, where telehealth had taken off, but we still weren't sure. Do families trust a telehealth assessment? Do providers trust it? We made sure that the protocol was the gold standard of what we would do, whether in the clinic or outside, but, does anybody like it? So this was just done with the Emory Autism Center in 3 districts. So we didn't, this is all we did, and they came to us. And this is kind of how the flow worked. So up in the red is that high risk fail. So there's a high risk fail. And what the Babies Can't Wait provider does, the service coordinator, is they offer the family, look, we have like kind of a script to help them if needed. Your child, had indicated some concerns, and the recommendation is a further assessment, a further autism assessment. They offered them this pilot, or they offered them other outside referrals. So if you follow the green and the family decides to be referred to us, again, at any point they can go gray, that we can refer out and give them supports. They get referred to us, and then we complete a consent and we complete some surveys, some intake surveys, including like a developmental history form and a standard measure called the TP4 that looks at all 5 areas of development. Once they complete those intake forms, we will schedule them. So I'm on the right side. We'll schedule them for the assessment. And again, Babies Can't Wait is copied on all those emails, all those follow-ups, and reached out as needed. We have built in at least 4 times to contact families prior to intake and 4 times prior with the intake forms, but often our coordinators, our family navigators reach out to families much more to help support them.
So,
Once
sorry,
we,
Allison, sorry,
yes,
just a quick question before you
yeah.
move on. Someone wants to know if the child needs to be enrolled in Babies Can't Wait to be part of this project, or is it like they could just call and then when they are initially
Yeah.
referred, they can get into it?
So they do need to be enrolled in Babies Can't Wait, and they need to be enrolled in Babies Can't Wait in one of the districts that's participating in the pilot. So for this first phase, we did Waycross, Dalton, and Dublin, and the only ones that could participate are those that were enrolled in Waycross, Dublin, or Dalton, and scored high risk on the MCHAT and agreed to be referred for this pilot. It's a great question. And so then we did the assessment. We did a child piece, which called the Tele-ASD Peds, the TAP. It's kind of what we would do in the clinic, but as clinicians, we're telling the parent to do certain things. So we tell them to get certain materials ahead of time. Our family navigators let them do, and we will direct them. At some point, we say, can you point across the room? Can you call their name? Can you offer them this container of something they want that they can't open? And I just want to say here, this is for you, and let's see what your child does to ask for help. So it's great observation for us as clinicians. And then we do, if needed, we do another standard measure that we fill out after. And we do an in-depth parent interview. We started with the ADIR, and mostly now, since about a year and a half in, we've done what we call the TASI, which is a great measure, and we can do it pretty efficiently with families. Um, we then provide feedback a week later, as well as the final report. You'll see how that's kind of changed a little bit in the second phase. So we would do the assessment and the parent interview on one day, and then a week later, we would do feedback and send the final report. And again, Babies Can't Wait was copied on all that. Babies Can't Wait could attend any part of it, and they received the final information. So what we found, and you'll see in the data that we show, we kind of collapse the data, is that it worked. People liked it. It worked. Psychologists felt really confident in their decisions. Families were really happy with the results. They felt when we asked them, does the psychologist get your kid? They said yes. Do you feel like you need additional information? They said no. When we asked if it was enough to access services, they said yes. Do they feel like it helped their Babies Can't Wait interventions? They said yes. It was a great response. So the question is, now we know it works. How do we expand it and how do we sustain it? So part of the contract pays for the Emory Autism Center to do these evals, but they won't pay for the state to do for everybody to do it. So how do we sustain it? So let's see what we did. We added additional Babies Can't Wait districts. Dr. Morrier, do you have a question?
Sorry, just another quick question
Yeah.
before you move on. And someone said they might have missed this, but do you provide the caregivers with a list of possible materials needed for the evaluation ahead of time?
Yeah, yeah. So we go over it with them on the phone and we send an email every time that lists exactly what we say that they have to have. Usually it's not very much. It's 3 to 5 toys. It's something that can roll like a ball or a car, and it's a container. And again, the family navigators have already just talked about it with them and told them kind of like why and prep them for what's going to happen. So some of our kids are food motivated, and we'll put snacks in the container, and then some of our kids don't care about food. So we might advise maybe a bubble that they can't open the top, or maybe we'll put a container that takes a car. Um, some of the families don't have things ready when they show up. They have other things going on in life. And as clinicians, we just roll with it and we make it work. And they're in their home setting and it's not a problem. But yes, they should be aware of what's going to be expected. So in phase two, we added additional districts, and you'll kind of see a list in a minute. We wanted to build our capacity by using community psychologists. So it wasn't just the Emory Autism Center doing this. Our job is to build the capacity and train others. Um, in order to do that, because Department of Public Health can't pay for all these assessments, we're going to use the insurance that these kids already have with the community providers. And what we're going to do is we're going to keep the family navigation and the Emory Autism Center as a hub, so that the community providers, when they get these families, they're ready to go. So we're still going to hold their hands through the intake process, and then pass them off for the assessment. So let's take a look at what that looks like. Oh, before I do that, so community psychologists, we required them to take at least one Medicaid. So they needed to take a Georgia Medicaid as well as either currently right now, Peach State, CareSource, or AmeriGroup. So we really want to make sure we're serving those that have hard access at accessing assessment services. So in order to participate, you need to take at least one of those. These providers, these community licensed psychologists, they attended a pretty in-depth CE training, about 3 hours initially, as well as quarterly, all throughout the year. We do about an hour and a half training, and that's a way to kind of increase their capacity as well as making sure that we're still valid and we're all scoring the same and we're all looking at the same things. They need to complete our survey, I mean, our protocol. So we have certain measures that we want for this assessment, and they need to use those measures, and they need to kind of follow the protocol. They also fill out kind of the survey at the end to kind of let us know what happens, and they need to take at least one case a month. So they need to open up, and most of them take anywhere from 2 to, I believe, 6 or 10. So who are these community psychologists right now? Right now, these are a list. I'm very grateful. So big shout out to them. Dr. Gifford at Stone Peace, Dr. Hollander, Dr. Groff and Dr. Dorr at Georgia Neurobehavioral, Dr. Hogan at Successful Kids, Dr. Smith and Dr. Dooley, as well as Dr. Augie at Children's Autism Assessment Center. And then we have some support at Mind and Motion. We also have 4 psychologists that are looking to onboard right now. So we're really excited to be expanding, which also helps expand to additional districts. Who are the districts? So I believe there's 18. Now I'm second guessing that maybe there's 16 districts, health districts. But so far, this is where we're at. So again, you'll see 1, 2, and 3. They onboarded in June of 2022. And then in like March, is really April of 2024, we onboarded Gainesville, Cobb Douglas, Albany, Columbus came a little bit later in June. Fulton onboarded in 2025, Augusta onboarded in August of 2025, and then we're looking to onboard LaGrange and DeKalb in 2026, pretty soon. So again, if you look after number 3, so starting in 24 is when we started phase 2. That's when we expanded to onboard a whole bunch of districts as well as the community psychologist. So what does it look like now in phase 2? So again, you still have this high risk fail. Everybody has to have that high risk fail. The family is going to consent to be referred. Now, it doesn't show it here, but anytime they don't want to be a part of this, we're happy to give referrals. This isn't that you won't receive services or anything. We're happy to give referrals. If they end up getting an evaluation somewhere else, we are thrilled for them. The goal is just to make sure these families are served. Once we get the referral, Lexi and Rachel and their team contacts the family. They do like a quick introduction. They review. Again, all they're consenting with Babies Can Wait is to be referred to talk about this. So they say, this is what we're going to do. This is the assessment. I'll send you the consent. And then they complete consent and they send intake forms. At this page, the only thing that's different, they still do a developmental history form and they do that standard developmental measure, the DP4. We also collect insurance now. So we added that at this point to collect not just what insurance, but we asked the parents to upload a front and back of their insurance card. Then, depending on availability and depending on insurance, because all the community psychologists take a variety of insurance, they either get assigned to a specific community psychologist or they get assigned to the Emory Autism Center. If they get assigned to a community psychologist, which they know about, that's been talked about from the first conversations we've had with families, we send an email to our system sends an email to the psychologist saying, would you like this case for this month and this year? And if they accept it, then they're expected to do the case in that month and that year. And we connect the families and we connect the psychologist to the information. We call the parents and let them know. And then we also send follow-up emails with Babies Can't Wait, giving them the clinicians and the practices information. The information that the clinicians receive includes all the developmental history, includes the developmental measure, and includes insurance. So they're already hitting the ground running. They also do any additional forms for their practice, and then they pre-authorize the assessment depending on the insurance and start scheduling. From the community psychologist to Emory Autism Center, the assessment can take anywhere from 1 to 3 sessions. I will tell you with Emory Autism Center, because we don't have insurance kind of restrictions, we often do this in one session if the family is open to it. So we will do the parent intake, the parent in-depth interview, we'll do the child assessment, and then we kind of do feedback if we feel confident. If we don't feel confident, we'll wait a week and gather more information, like videos. Sometimes we call Babies Can't Wait, or we'll call a school system, like the preschool or somewhere. I will say with the community providers, given the restrictions of insurance, which I'm going to talk about in a minute, they often have to do 2 to 3 sessions. So if an insurance requires a pre-authorization, they have to have an intake with the family first and then pre-authorize it to then do a second session with the family to do the assessment, and then maybe a third for feedback. Again, Babies Can't Wait is copied on all this, whether they come to Emory or they go to a community clinician. Babies Can't Wait is copied on there, always gets the final report, and is reached out to for support as needed during the scheduling process. Okay, so what does it look like? Let's see it. And I know I'm a little slow, so I'll speed up.
Sorry, before you go, there's a
Yeah,
couple of questions on insurance rates. Like what is the
yeah,
reimbursement rate for the community psychologist, and is there a
yeah.
range or is it kind of a flat fee?
Yeah, that's a great question. So part of this and why this is so great, and our Department of Health, I hope I don't get in trouble, but is the collaboration is that because they are enrolled in Babies Can't Wait, they are Babies Can't Wait, Department of Public Health is a payer of last resort. So if the child has like a Medicaid, usually they cover the entire assessment at the Medicaid rate. Now, I will say as a psychologist, that's not a great rate, but hopefully we've taken some of the work of the insurance piece and some of that off of it, and these psychologists are just dedicated to this work. So they get covered the entire rate. If a child has no insurance, the psychologist bills Department of Public Health, Babies Can't Wait, at the Medicaid rate, and they get reimbursed that way. If a child has a private insurance and they have like a high deductible, that again, they will never incur a cost. So this is a family that has a high deductible. We have a lot of families that, let's say they work for the state prison in their area and they have insurance through that, which is great. They have a job, they have an insurance, but they can't cover a $800 deductible for the assessment. Well, because they're in this program, the psychologist will get reimbursed at the Medicaid rate according by Department of Public Health, and the family will never incur a cost. Families don't incur any cost as a part of this program. Psychologists get paid either, at the rate of the insurance or at least in the minimum of the Medicaid rate, which isn't great. But again, our psychologists are pretty dedicated to this work and this early identification. So 6/1/2022, again, and that's phase one. So these are the districts at the bottom that kind of onboarded at phase one. The light blue, 4/1/24, are the districts that onboarded initially at phase two. Then you'll see Columbus came shortly after, Fulton came the next year, and then Augusta came in August of last year. So from the whole duration, we've had a total of 674 referrals. You can see there's some districts that need us a lot, and there's other districts that don't. There's districts that depend on size. Dalton has been great, and we'll talk about one of the limitations. Dalton has a lot of Spanish-speaking families, and right now the pilot does not accommodate that. It is something that we are looking forward to, but we're missing some families in Dalton because of that, and other districts as well. Other districts like Waycross was one of our first, and they've been doing telehealth for years before, and so they were ready to go. Augusta had a huge need. Augusta, I learned, is a huge district. It's a very long, very big, and so there's a lot of people with not access to a lot of supports. This is just so you know for each year. And again, the years start for us in June, but for this is the year. So in 2022, how many in gold were referred and how many in blue did we evaluate? So again, in 2022, it was just Emory. In 2023, it was just Emory. In 2024, we started using community psychologists. 2025 was Emory with community psychologists. So you can see we've almost tripled our capacity by being able to use community psychologists, and we still have room to grow, which is great. So the model isn't just that we've proven a university can do a telehealth assessment. We find that what we do really well is that this is a sustainable model because the use of insurance that we can continue to expand and not rely on state resources. So out of those 674, we have to date completed 441 assessments. Um, 48 additional children are scheduled. 22 additional children are in intake. Um, 40 were referred but did not meet criteria. Several of those Babies Can't Wait refers to us. They know they don't meet criteria for one reason or another. It might be age, it might be the MCHAT, it might be language, that they're Spanish speaking family. A lot of those we have been able to connect with other psychologists outside of the study and the pilot. 123 have withdrawn. 13 never consented. They didn't for various reasons. 34 decided not to participate, and 76 withdrew after consent. So out of those 435 cases, again, a little of the data is still coming in. So that we assessed, I know we said we did 441 data on 435. 245 were at Emory and 190 were community psychologists. But again, community psychologists started 2 years after we started. So they're quickly gaining ground on Emory's assessments, which is great. Out of the 435, 428 were diagnosed with autism. So these kids are what we often unambiguously be able to identify. They are being identified by the screener. They're being identified by Babies Can't Wait. They need these assessments and diagnosis to access even more support than they're already available to them. 58%, 251 also meet criteria for global developmental delay, so a second diagnosis. Majority of these kids are nonverbal or single words, and then you have a few phrase speech and fluent speech. If you look at the time of referral, so the time that Babies Can't Wait sends the referral survey to us, to the time that the feedback report is sent, it is averaging 61 days, so 2 months. So individuals are getting an evaluation and getting their report within 2 months. If you take out a couple of the outliers and look at the median number, it goes down to 55. So we have some families that are in there for 4 or 5 months. Some of them left and came back. Some of them had family kind of concerns. But these families that would have waited 2 years plus for an assessment are getting through the process within 2 months. Psychologists on a scale of 1 to 5, 4.74. So we feel pretty confident about these assessments. We feel confident about the diagnosis. We feel good about the outcome. The feedback from we survey service coordinators, we survey early intervention coordinators, and we survey families is that they're really happy. Again, they like these assessments. They don't feel like they feel like they're getting a thorough assessment. They feel like they're being seen, their kids being understood. The only negative that we do continue to hear back is just additional supports for after the diagnosis. Some of them is just the limited resources we have in some areas. My experience, this is a parent, my experience was really great. Everyone I met at Emory, from the intake coordinator to the psychologist, was professional, kind, and helpful. They answered all my questions and made me feel supported. I also feel very thankful for the Babies Can't Wait team. My service coordinator and speech therapist were both amazing. I truly appreciate everything they did for me. I love that additional comment someone sent us as part of the survey we send out afterwards, because it really highlights the connection, not just what we're doing, but Babies Can't Wait, and that the connection is going both ways. Another quote from someone that went to a community provider. So again, the concern was, would they still get the same great support that they get at Emory when they go into a community provider? And the whole process was a breeze. It was helpful. I'm very grateful to have been led to this program. So still able to access services. So what's next? I'll try and hurry up. We're going to advocate for, as part of this, is to lessen the pre-authorization. So this group is going to advocate for kids that meet certain criteria that are high risk on an autism screener under the age of 3. Why are we requiring a pre-authorization to make visits from 1 visit to 3 visits? What the psychologist says, often the families are tired. They have to take off multiple days. The kids what are they going to do with the care for the kids? So if they want to do 3 days, great, but why are we requiring that when we can, we're pretty confident that 98% of the kids with these kind of coming in can meet reason for a referral and a diagnosis at the end. So we are writing a letter to kind of the state. Our friends at Marcus is going to join us, as well as a psychologist in the Department of Public Health, to kind of like sign it and see if we can get some changes made for that. Another is we're expanding. So we want to cover more districts. Like I said, we're about to onboard LaGrange. We want to cover the state. We need to increase psychologists. So we're about to onboard 2 to 4 new psychologists to help support this. We're also looking to see, like, can we go down to moderate risk on the autism screener? How do we include Spanish speaking or second language, a different English as a second language families? Most likely, we're looking at additional funding to kind of look to see how do we support these families and use this model as a basis to expand to these families. We're also, and I'll go pretty quick, looking at Early Point. Early Point, I don't know, I know y'all have done some trainings and professional learning on Early Point. It's the eye tracking. It just got approved up to, I believe, age 7-11. So what we're looking to see is, how can Early Point help? When is it needed? Do the parents like it? Do the psychologists like it? Does it save time? When is it needed? So we're it's going through IRB right now, and we're looking to pilot this kind of additional phase 3 Early Point with 2 districts to start with. So I'm going to turn it over. I'm happy to answer any questions to Lexi and Rachel. Do you have another question?
Just a couple of questions, but finish with what you were saying.
No, go ahead. Go
Okay.
ahead.
How are the private psychologists and providers chosen? Can a trained staff not holding a psychologist credential deliver the assessment? And what other than Spanish, are there any other non-English languages that you are trying to prepare for?
Yeah.
Um,
Okay, wait. Are you okay? I'm going to answer
sorry.
those, and then if I miss one. How are they chosen? So we had what's called the Georgia Autism Assessment Collaborative. So again, Dr. Morrier, when he was at the Emory Autism Center, and Dr. Rice did a lot of training across the state to help community psychologists be better early diagnosticians of autism. And so out of that group, we've kind of we pooled, and whoever was interested had training already and took a Medicaid or CMO insurance was eligible. Now, we also have done outreach and try to build within the field, and then we do additional training. So not just they have to have an interest, they have to have a desire to do it, and then they have to have the training and be able to serve the kids and the families that we serve. Can a staff member do it? So I will be honest, in community psychology practice, they operate in many ways, and some use what we call diagnosticians. It's always a licensed psychologist that signs the report and is responsible for it. I believe with all of ours, the psychologists are doing these evaluations. They're doing them directly. One of our first providers, who is now took a job with the state, she had a diagnostician that worked with her, so she would sometimes be on, and the diagnostician would be leading it. At Emory, we work with postdoctoral fellows. So sometimes they're leading it and I'm on in the background. But I am always responsible for that assessment. I always lay eyes on the kid and the family. Often I jump in and answer questions. The question about the Spanish speaking, the idea for the pilot, for what I would like and kind of what we've tossed around, is that We'll probably pilot first with Spanish, but really it's a second language pilot. How do we reach families? So I don't want to just hire a bilingual psychologist, a Spanish speaking psychologist. I really want to create a system to be able to sustain, it's not one person dependent evaluations in a second language. So what resources, what translation resources do we need to have along the whole way to provide family navigation as well as a gold standard assessment for families that don't speak English? How much additional time does it take? How much additional resources? So I wouldn't limit it to Spanish speaking, but I know that's been the biggest group that's been brought to our attention. Was
That's
there
it
another
for
question?
that's it for questions.
Okay, great. Those are great questions. So I'm going to pass it over to, I can't see everyone on my screen. Oh, I see some parents. I'm so excited. I'm going to pass it over to Lexi and Rachel. I'll let them introduce the families and introduce the Babies Can't Wait providers and introduce Department of Public Health. And then they're going to ask some questions and you guys are in for the real treat of this presentation.
Hi, everyone. Thanks for joining us. We're going to start by introducing our parents. So we have Kenyatta Harper and Dove Jackson, and we would love to start off with just kind of hearing a little bit about their experiences. And just so everyone knows, we may limit some responses just so we can hear more responses from everyone here and get a better response or a better view of what's going on and everyone's perspectives. But Kenyatta, if you would love to start us off and give us a response about your overall experience or if something stood out to you in this program while you were going through it.
Yeah, awesome. Well, as you all heard, my name is Kenyatta Harper. And I would like to just start off by saying, I actually have had a relationship with Babies Can't Wait, believe it or not, for more than 18 years. I actually have a son who at the time needed some resources, and we were directed to Babies Can't Wait. He's now 21. And even then, just the connections and the relationships that Babies Can't Wait, the relationships that they built with me was just so impactful and long lasting that years later, now that I have a almost 3-year old, when I noticed that she was in need of services, I instantly thought Babies Can't Wait, because that's just how impactful this program was to our family when we needed them years ago. So, and my whole experience, even then, 18 plus years ago, and now recently within the last year, almost year and a half, has been nothing short of amazing. Just from Dr. Swartz and everybody at the Emory Autism Center, speech therapists that Babies Can't Wait has connected us with, and so many other resources they've connected us with has been absolutely phenomenal. It has probably been the best experience ever. Of course, finding out, that you have a child that has special abilities sometimes, can be a little bit taken aback, if you've never dealt with it or anything like that. But just, having Babies Can't Wait there to just pretty much walk us through everything, help us with questions that we needed answered, and everything like that has just been absolutely amazing. In fact, I have personally referred several parents to Babies Can't Wait when I've spoken with them and they may have concerns or questions. They ask me, why, how did you know that, she needed some extra services, or how did you know, who did you reach out to? And instantly it's Babies Can't Wait. Oh, and I said, once you connect with them, they are pretty much going to walk you through step by step, and you're not going to have to worry about anything. So that's been our experience and our journey with Babies Can't Wait. I'm just so thankful for everybody that we've connected with and that they have connected us with. It has been such a blessing and so helpful to our family.
That's great. Thank you so much for sharing that. And they came through the Emory Autism Center, so they saw Dr. Schwartz. And then our next parent is Dove Jackson, and she is from the Augusta district, and she saw a community psychologist. And we're actually going to have you share the same kind of response. So if anything stood out to you or just kind of an overall experience.
Hey. Hello, everyone. And what Kenyatta said, absolutely. Can y'all hear me? Because I'm in my car, Bluetooth. Okay, we're rolling. Okay. Yeah, so Babies Can't Wait, of course, has been instrumental because I wouldn't have found you guys without them. They do help you with everything. One thing that I noticed that y'all touched on the meeting is that autism is really underserved, like as far as getting the resources, trying to find out who to go to, the waiting list. So Babies Can't Wait really was a catalyst for that because it puts you in the front of the line. Because like I think that you guys I found out about Emory pilot on like a Monday. Wednesday I was in. The next Monday I did the actual evaluation. So it moved really fast, but it gave my family the clarity that we needed. It's not easy to hear. It really isn't. It taught me new verbiage. You know, I didn't know about neurodivergent, neurotypical. Dr. Savannah is amazing. Um, and then you guys, gave that book 100 First Days of Autism. That was very helpful. I don't know if she just gave it to me or did y'all get it too? Y'all got it? Let's see. But yeah, so wait a minute. Okay, y'all can hear me. Okay, cool. So yeah, it was because it's not easy. And but one of the things that I can say is that um by you guys having this program, because the evaluation initially with Babies Can't Wait was for psychologists, and it was a 7-month waiting period. So between that time of him being diagnosed, I would have to wait I would have still been waiting to July to even, well, not even diagnosed, for him to, we knew he needed to be diagnosed. That evaluation period was going to be 7 months. In 7 months, so much has happened. I didn't know about stimming. I'm learning about stimming now. I didn't know about, sensory things. And for 7 months, my baby would have just been struggling with me not knowing had I not had the resources. So I think it's great. I think that it really, like you said, Augusta's huge. There's a lot of children that need it and they're not able to get it. They don't find out about it until too late. They age out of the program before they can get into the program. It's a mess, but I'm blessed that we were a part of it. But I can say that you guys are doing a phenomenal job because it's not easy. It's not easy to have these conversations with someone about their children. And the fact that y'all are trying to make sure that the resources are available, yes, because it truly, you call it ABA, you're on a list for 6 months just to get an evaluation. So this kind of gets the ball going. The ball is still slow after you get it going, but at least you're in the door. So that's my experience. It's been good.
Thank you so much for sharing.
You're
We
welcome.
really appreciate like even you putting that message in the chat. Like that is the goal of the pilot. And we're happy that you guys were able to get evaluation so quickly. And just kind of moving on, like as we continue to talk about like the goal of the pilot to Miss Sunita Griswell. She is the Autism and Developmental Disabilities Program Manager for Georgia Department of Public Health, and she's been working at GDPH for 11 years, but has been working in
Wow.
her current role as the program manager for 9 years. So Sunita, you have so much experience working like within this space and dealing with these underserved communities that we're talking about here today. So with that in mind, we just wanted to ask you what motivated the Department of Public Health to partner on this initiative for the Early Diagnostic Response Model.
Yeah, absolutely. Thank you, Rachel, for the question, and thank you, everyone, for sharing your experiences. It really warms my heart to hear that this has been a positive experience for so many, and that we've touched so many families and supported so many of you in this way. So, what really motivated us to start this initiative was just looking at the data and looking at the gaps. It truly helps to guide my work by seeing where the challenges are for families, and it gives me a lot of joy to develop solutions. And we do our best to develop those solutions with families in mind and meeting families where they were. As Allison mentioned, our starting three included Dublin. And at the time, Dublin was identified as having what you would refer to as a healthcare drought or desert. For example, a hospital in the area or a nearby hospital in the area had closed down. So a lot of families in that area weren't able to access services without having to drive hours, or they were experiencing significant wait times to the point of 2.5 years when we originally started this back in 2016. So our motivation came from the need, and we started with Dublin because it is positioned in the state of Georgia in a way where it's often challenging to access services. So we took the virtual route in order to get families services in that area. Yeah.
Yeah, I mean, yeah, thank you so much for sharing. I mean, we've already heard it a little bit today, with even Dev talking about her experience like in Augusta. There is such a need. And I mean, Lexi and I would not be employed in this position if it was not for EDRM being here and being able to support all of these families that come through. So yeah, and this has been like your little baby working with EDRM, and as well as Dr. Schwartz, who's been working like on this project since her postdoc. So yeah, we're really appreciative of you guys for putting in the work. But just kind of switching to the Babies Can't Wait staff that are kind of like also like on the grounds, like speaking with these families every day. Starting with Miss Kira, we wanted to ask, how does early diagnosis in your eyes impact long-term outcomes for children and families?
Hi, good afternoon. Can y'all hear me? Awesome. Thank you so much for the question, and thank you for inviting me to be a part of the panel. And so again, the name Babies Can't Wait. These kids can't wait. And so we want to make sure that we are touching these babies as early as possible to make sure that if they are concerns, that they are connected to those resources in the community.
Yeah, and I mean that's great, and thank you so much for sharing. And I also forgot to introduce a little bit about
It's
who
okay.
you are and what you do. But we actually have early intervention coordinators on the call with this as well as service coordinators. So the early intervention coordinators, the EICs, like Kira, are responsible for kind of like the entire like health district. So they're responsible for communicating with the service coordinators and like us as well. And really are a big part of like getting us onboarded within different districts. So yeah, thank you so much for sharing.
Okay, and our next person, we're going to go to Miss April Bird, who is one of our service coordinators with Augusta. So this is one of our new districts. So we're excited to have her here. And we're just going to start off with like what kind of differences you guys have been seeing from referral to diagnosis timelines, because I know this is kind of like a newer thing, so yeah, I'm sure that's more fresh on the mind.
Hi, nice to see y'all. Yes, so we started the pilot in August of 25, and it's been a success in my eyes. I really refer a lot of kids over to a lot of kids over to the EDRM program, the pilot. So I honestly, I can say that I most recently have referred at least 2 kids per week. So the need is here. It really is. In doing the ASQs, like Dr. Schwartz said, that we were trained to not only just gather the information from the parents, but also gather information from the medical records and the referral as well. So we see it in the ASQs and we see it in the MChats. And then we also see it when we go out and do our observations in their natural assessment, in their natural environment. So even though we have those pieces of paper and all of that, like we're also observing it as well, working with those parents and just having those connections and seeing the concern, and they just don't even know what the concern is, where it's supposed to be. They just know that there's a concern. So that's where we kind of step in and let them know. And a lot of parents are uncomfortable with the diagnosis of autism, the ASD diagnosis. So just talking them through that and just letting them know my spiel to the parents whenever we do that. A lot of them are hesitant and saying, you know what, like, I just want to wait it out. I just want to wait. I want to see what happens. So I always say, get the assessment, and usually that is your key to any door that you need. So that letter of necessity is what you need. So, but yes, I feel very confident in the program with all of the materials that you guys have given us. that long packet. I go through that a lot. I've made my own little packet to share with the parents so that I'm not only telling them, but they can also read it as well, and then see your faces of who they will be connecting with. So I think it's a really, really good program. So thank you.
That's great. Thank you so much for sharing. And then our last, but certainly not least, Miss Marlene Gordon, who is also service coordinator with Albany. So Albany's been with us for 2 years now. And we just wanted a little reflection about like how your experience has been with parents' response in referring them over or even getting a high risk score on the MCHAT, that kind of area. If you'd like to reflect on that, thank you.
Yes, so pretty much all of my families have responded positively to referrals for the telehealth autism evaluations, especially when the alternative is a long wait for an in-person appointment. They appreciate that telehealth is faster, more convenient, and that it also lets the clinicians observe the child in their normal home environment. So many families they also report just feeling comfortable with the process and just saying that they would choose telehealth again and recommend it to others.
Yeah, thank you so much for sharing y'all's thoughts. Yeah, and I on that thought of like referring others and telling others about it, we did want to go back to like the parents that we have here that have gone through the process. Um, we have a lot of people that are in this webinar that are involved, that are stakeholders with autism policy within the state. And what would you want providers and policymakers to better understand about y'all's experience getting access to these evaluations for your children? Yeah, and if either of you guys want to jump in, or if you have no thoughts
Okay.
on the yeah.
Now I have thoughts. I'm glad you asked. Okay. So no, okay, so one of the things that I noticed is that my son, when we were given, the care plan recommendations, his hours are more than work hours. It's almost like unrealistic, especially as a single parent, to have a full-time job and to try to get your baby where they need to be. And you're not eligible for much. So if you have a full-time job. So I think that it needs to be not recognized as a disability necessarily, but um it has to be more support because it's like here's the diagnosis. Okay, now you need to do 42 hours of therapy, and it's going to be at two different locations. So try keeping a job with that schedule. It's challenging. So I think that that was one of the things that I was kind of like, okay, they told me everything to do, living to keep doing it. You know what I mean? So it's like there was that, and then another thing as far as the weights I think I don't want to slaughter her name, but the first lady, Schwartz, who was talking earlier, what she was saying was about it being a long wait, to get services, and if you are not eligible for Medicaid, which I almost wasn't, then you have to pay that $800, $900. And that's not real. That's not very realistic for the average family. So these kids go undiagnosed, and then for parents who have a tough time hearing it, you know what I mean? Like maybe your child is doing things, it's harder for them because there's not really a community that's like, hey, we're here for you. Like when your child is having a meltdown, this is what you could do. Like they tell you what's going on, but don't tell you how to deal with it. So you go to ABA, you ask them, but it's a 6 month waiting list to get in there. So 6 months, you figure it out. We'll see you in 6 months. So it's kind of like that's the only thing that I'm not crazy about with the policies is that I love the fact that they have a pilot that puts you in the right direction. But once you get in the right direction, you're just kind of like this with a map, you know? So you have to do what works for you. You have to build your own community, which I am currently working on. So y'all will see me. But yeah, that's my only thing.
Yeah, and I agree with what Dove was saying. I just wish lawmakers understood that, autism, it doesn't just affect the child, it affects the entire family. Just appointments, therapy, the financial strain, the continuing advocacy that we have to advocate for our children, And I just wish that resources and things that would help the children were easily accessible, more easily accessible. And a lot more easier to navigate. I mean, because there's a lot of resources out there, but there are it's like you're digging for information, um, and I feel like this program is really just absolutely amazing because I feel like the early intervention is what's really going to help a lot of families, because I feel like the earlier you find out, and you can get those resources, those therapies and things started. And I'm a living testimony to that because I think Casey was 21 months old when Dr. Swartz did her evaluation. She's now getting ready to be 3 in August. And just the therapies that we have been able to access this early on compared to some other families that basically joined waiting lists when we were getting our diagnosis, and some are still waiting. Casey has made such amazing progress. She's speaking, she is the eye contact is there, she's interacting, she is, I mean, just so lively. And most people say, I would have never thought that she was on the spectrum. I would have never guessed that, and she was diagnosed level 3 autism when she was diagnosed. She is due for her reevaluation coming up with Babies Can't Wait next month. And we are scheduled for the 14th, I believe. So she is due for that because she will begin to age out, once she turns 3 in a couple months. And I just know, once her evaluation is done, I'm just excited to see the progress, that it's going to show, because me as a parent, even her therapist and everybody, they're just like, oh my goodness, she has made such great progress. And I do believe that that is because she was able to access that early intervention as early as we did. So I just wish, lawmakers just really made the resources a lot more easier for parents to access, and it's not like a hard thing to access, so that's my, hope and wish that maybe in the future, it'll be accessible to everybody who needs the services.
That's great. Thank you guys both for sharing. Loved all the input. And I saw, April, your comment, and I thought might want to expand a little bit about some of the resources that are there and some of the support you guys have for providing. And if Marlene or Kyra, you want to jump in as well, that'd be great.
Excuse me, sure. So when Katie Beckett is a program that kind of will assist families who won't usually qualify for not Babies Can't Wait, I'm sorry, qualify for Medicaid. So a lot of babies that I have referred over to the pilot and were able to get that diagnosis, get that ABA therapy, then they get the bill and they're like, oh my goodness, this is crazy. So Katie Beckett would be a supplemental application to a Medicaid application, that if you're approved, and it's a long process, it really is, but it's very much well worth it, because it will help with some of those costs of ABA therapy, of speech therapy, of physical therapy, of occupational therapy. So it's a resource. It's just kind of like we know about it, but we are not responsible for the application. And so I provide, links to verify point of contacts, things like that, so that they can, provide those resources to the family so that they can themselves reach out to them and make those connections and maybe possibly get a how-to guide. Because of course you don't want to give any of the wrong information, but I do give the point of contact over to our designated Katie Beckett representative here in Columbia County or in Richmond County.
Yeah, and echo everything April said. So we do make that warm handoff for Katie Beckett. And keeping our fingers crossed, all of our kids have gotten approved, that have gone through the pilot. So that is amazing. And that, again, like she said, that does help offset some of those costs for ABA therapy, for, speech, feeding, whatever the child may need. So I echo everything April said.
Yeah, I mean, that's great. Thank you guys so much for sharing. Like access to services after the diagnosis is hard, and then access to services after. We understand is somewhere that we still need to make work and continue to like put our implementation efforts. So talking about implementation efforts, going back to Miss Sunita, we wanted to ask you, even when it came to like the EDRM, in this process, what were the biggest implementation challenges that you experienced at the system level?
Yeah, that's a great question. I would say some of the biggest implementation challenges were just around workforce capacity. So really pulling together those professionals that were trained. It helped us in a sense where we had this existing network of licensed community psychologists that we could pull on. However, what many don't know is that there is a contractual process in place for licensed clinical psychologists with Babies Can't Wait. And we experience a pretty large challenge there in terms of finding the professionals that were ready to commit at that level, the contractual level. And there were a number of reasons for that, but what that resulted in were just the continuous wait times in the wait list. So with EDRM, we were able to sort of bypass that contractual process, but still rely on our network of psychologists that were trained by Emory, that continue to receive ongoing training and support by Emory, and that we're still committed to serving our families. It's just that sometimes there is a little bit of red tape, should we say, that delays the process for families. So we were committed to removing those barriers as best as possible. And we're still, refining that process and smoothing out what it looks like for providers. But I would say that was one of the largest challenges were just around how do we find the network of professionals that are committed to this? Like Allison said, the professionals that are accepting Medicaid. Around 60% of our families are Medicaid recipients. So that was really important to us. How do we find the clinicians that are trained and want to focus on autism, not only autism, but the children in the younger age groups? We knew that early was best. So we wanted to make sure that we were seeing these families early. How do we also find professionals that are committed to our cause enough to somewhat clear their calendars and make space for these families that are sort of primed and ready? We've, like many of the service coordinators have said, we've observed, we've collected all of the data, we've looked at the medical reports. So now we're coming to you with this sort of like prepped assessment and packet for this family. We just need, based on what Georgia says, we need this clinical psychologist to perform the evaluation. So workforce challenges were some of the greater initial challenges.
Great. Thank you so much again for sharing. And then we do have a question in this chat asking for families in denial about the need for autism assessments. What have you found to be the best approach for referring families for an ASD assessment? And do you have any literature regarding this? And I would love to direct this towards some of our Babies Can't Wait providers, if any of you guys would like to touch on that.
So I don't have any literature on it, but what I can say is when I do my MChat, or when I conduct my MChat during whatever meeting it is, I will score the MChat and explain the MChat scores to the families. And if it is over 8 and they are uncomfortable with that, or even if it's over 1, just letting them know those medium risks, because even a medium and a low risk is a risk as well. So I still provide that to them, explain the answers, explain the scoring material, and then I let them keep it. I let them keep the evaluation so that they can, throughout their day, go through that evaluation and say, oh my goodness, maybe, let me talk, and then I'll follow up with them in maybe a week. Hey, how did you did the MChat? Maybe do it once a day for the next week. And let's see if your scores are different than mine, things like that. And so that helps me because at the end of that week, I'm making a survey recommendation over to you guys. So usually that's how it goes. Yeah. So I'll do the MChat with them, explain it, and then let them keep the results and then do it for themselves if they're not in agreement at that time. So I don't have any literature on it, but maybe I should write some or something.
That's great. Marlene, do you have any takes about how you would handle a situation like this as well?
Yes. So whenever I'm doing an MChat, after the screening is completed, as April said, I discuss all the scores. And my approach to it is I like to let my parents know that even though we're seeing a high risk score of a child possibly being autistic, once a child is diagnosed, there are so many resources and with the child having an autism diagnosis, it just to me it means that that child just operates in their own way to navigate the world. So from there, I go on to if they are diagnosed with autism, they have ABA therapy, which is applied behavior analysis, and they will be able to help your baby be able to navigate the world as they see it. So from that point of view, parents kind of be like, okay, and I just also let them know that this is not labeling your baby. This is not a label. This is just letting you know that they just have a different way of processing things than we do.
Of course, of course. That's great. Thank you again for sharing. And lastly, Kyra, if you would like, we were kind of wondering if people were in denial after the diagnosis and how to approach that, if it happens at all.
Yeah, so we have had that happen. Once we do the final visit with Emory, then we absolutely give the families time to process because this is a lot to kind of take in. And then we will actually have another meeting with the family and talk about all of their options. We have this available, we have this available, we have this available. Typically they have somebody, okay, my friend told me to go here, or I have an older child, he's already going to, this agency. And so they have some things in mind, but we really talk about what is this going to look like for this baby moving forward. Like Marlene said, this is not a label, but this is just opening up the doors for additional resources and services for this child to make sure that their needs get met. And so, again, this is a sensitive conversation, kind of a tough conversation, but we do give them time and allow them to process the report, the findings, and then we'll proceed from there.
Yeah. And thank you so much for sharing. I mean, that's like a really important topic because we can give the diagnosis, but if nothing's done with it, then they can't get the access that they need because the diagnosis, again, is just paper. So, yeah, and thank you guys for answering all of those questions. And we are kind of reaching time, so we just wanted to end with one last question, um, asking you guys, is there anything that do you want to share or that you want to communicate that you haven't had the chance to about your experience like with early diagnosing, whether it be like as a parent, as a service coordinator, EIC, Sunita, any last takes that you guys want to share before we end the webinar?
Yes, this is Kyra. Really quickly. At the beginning of the meeting, Dr. Schwartz, she mentioned Columbus. And I just want to give a shout out to you because I will pick up the phone and call you and like, hey, we just got this baby. This baby's 32 months. We really need an evaluation. And she listens and she's like, okay, let me see what I can do. Um, all of my families that we have been referred to this pilot have absolutely loved this pilot. Um, they are so impressed with the reports, the professionalism of the psychologists, and the quick turnaround. And so I thank you for allowing Columbus to be a part. We are the third largest city in Georgia, but we only have 3 psychologists in this area. And so a lot of our families have to travel either to Atlanta, to Warner Robins. We have some who travel to Albany. And so this gives another opportunity for some of our families to get this diagnosis quickly because the wait lists here are 6 to 8 months. So again, thank you for allowing District 7 to be a part of this pilot.
Yeah, I would just piggyback on that in saying, as we shared earlier, we are approaching 11 districts that will be a part of this project. Very, proud of that growth and expansion. But I also like to share that it is our goal and our intent to make this an available service in each of our 18 public health districts. So we are slowly getting there, and, we won't stop until we have this available in each district. And we also hear the sentiments and the need for the next step. If I'm speaking candidly, I will say that we've needed to build this step by step. Prior to 2019, we were not offering the MChat within Babies Can't Wait as a screener to even flag these children. So we had to rely on the pediatricians, who also do a great job, but we had to rely on that report to come down to us from the pediatricians. And sometimes that delays the process further as well. Like, we don't receive that notification until later within the child's time and their services. So, got that off the ground. Now we're soaring in terms of diagnosis, and we'll continue to cover the state, but we are diligently looking at solutions in the intervention stages as well. So yeah, just saying that we're going to continue and always want to hear from families, hear from providers, because we don't want to create and build something that is good in theory but not good in practice.
Yeah, for sure. Thank you guys so much for sharing. I don't know if anyone else has any thoughts. Marlene, April, I don't want to, yeah.
I have a little bit I want to add. I'm just so thankful for this opportunity to for these babies and families to be able to get diagnosed early, because it also helps us as service coordinators out too. And what I mean by that is once we get these once we get the evaluation results back from Emory Autism Center, we're able to look through it, look at the recommendations, and with that, we still have enough time to be able to send necessary referrals, update individualized family service plans, and even be able to provide that to the school system so they will know how to move forward with services once the babies exit out of Babies Can't Wait. So I really do appreciate this early diagnostic response model. It has really helped my families.
I piggyback off of that as well. I do. Even with some of the parents who have babies in the daycare, say for instance, and then they get that evaluation and they are not understanding that those ABA therapists can go with your baby in the daycare as well to teach them good behaviors too. And then from there, whenever you transition into the school system, you might be able to get a parapro that's assigned to the class that you're in to help your baby there too. But if you don't know, you don't know. So I really appreciate this this pilot, not only for Babies Can't Wait, but even whenever they're growing out of Babies Can't Wait and they transition into the school system, it's really preparing them to be better students and better babies, not better babies, but it helps them develop behaviors that will help them grow and grow and grow. So I'm really appreciative for the program as well.
Thank you so much. And I mean, last but definitely not least, I think Carla said it for all of us in the chat. The parents who are the backbone of like being able to move these children and really continuing to work with y'all's kids and continuing to get your children the access. I mean, I feel like you guys are your children's like superheroes. So making sure that they get the access to services that they need. If you guys have any last thoughts, I know you guys already shared. Yeah, if you guys have any last thoughts about like the pilot and just early diagnosing in general, before we all hop off.
And there are just
Nope.
a couple of questions in the chat once everyone's done.
Go ahead, Deb or Kenyatta. You have anything you want to add?
Oh no, I was saying no.
Yeah. No, I
I
don't.
was
I was
saying,
just gonna, say, of course, I'm just still incredibly grateful for Babies Can't Wait. And I'm so excited for the families that are going to benefit, like we've benefited. So yeah, that was it. I don't have anything else.
Yeah, I'm proud of y'all expansion. Seriously, this is awesome. So
Yeah.
this is really good because that's what the problem is the referrals. Hi, baby.
Let's see if she'll
But
say
yeah,
hi because she's coming
let's
back. You
see.
want to say hi? You see Dr. Swartz.
Hi.
She's a little baby. Oh, she's single.
Hello, gorgeous.
Say
Hi.
hi. Hello. Okay, she got a hi.
Yes, you did it, girl. Yes. Yes. But no, that's it. That's like you guys are doing the work because that's what the issue is the delay with, being able to get the diagnosis because that gets the ball rolling every day. They're learning something different. The world is a different, like you said, they see it differently. So we do need this help. They do need to be surrounded around people that let them know that it's okay for you to grow this way. It's okay for you to learn this way, but maybe we can do it this way. They need that. So I'm grateful because I would have still been waiting. So there's that. I'm grateful.
I just want to reiterate, I know there's some questions, is that I think the success of the pilot is just not the sustainability of insurance, is that it's the partnership. So again, they're starting these conversations with families before they get to us, so they're ready. I mean, by the time they go through Babies Can't Wait and my family navigators, my intake coordinators, the family's ready to go. They're open to it, they're willing, and then they know they're going back to support. And I think that's what makes this pilot so unique and special is that we're not just, it's the families that come from the community that come to see me. I get the same care and support, but I'm sending them out the door to no one. These families, I am sending them back to these great providers and these great systems that are ready for them. They're ready for them. They're ready to support them, which is amazing. I see a question about how to refer. Is that one, Dr. Morrier?
Well, there's that one. And then there's just a couple about the psychologists. One question I had actually was, are there psychologists in the districts that
Oh, yeah.
the Babies Can't Wait
Yeah.
kids are coming from, or are they from different districts? And if they're not in those districts, someone was wondering if psychologists licensed through SIPAC, are they eligible to be a provider that may be able to help some of this going on? And then is there anything going on about insurance or Medicaid reimbursement rates? Because that a lot of psychologists are leaving because they're not able
Yeah.
to afford it. So that's kind
Yeah.
of all. Plus, how
Well,
do you get
so
connected to
about
Babies Can't Wait?
the psychologist, so the beauty of the program is that a psychologist in North Georgia can evaluate a child in South Georgia without any issues. No travel time, no driving. Some of our families don't have cars. They don't have reliable transportation. They can't take off that much work. So that's the beauty of the telehealth in the program is that it doesn't matter. The question about SitePack, I'm SitePack certified, but we haven't thought. Right now, we're relying on psychologists within Georgia. We're trying to be kind of homegrown. It's definitely we aren't at capacity yet with the psychologists we have. Like I said, we're onboarding a few more, but it's a great idea and it's a great thought and something that I'll definitely think about, to resources outside the state if there's site pack. But right now we're relying on supports within Georgia and we try and educate our psychologists continuously about resources to support within Georgia during, and after. The last question about referral. So right now, unfortunately, families have to be in one of the districts we're serving. So they have to be in a district we're serving, and then they have to have a high risk fail on the MCHAT. And then with that, they'll be eligible typically. We like to get them by 33 months at the latest, just so that we can make sure that we get them through the process before they age out of Babies Can't Wait. So they have to have a recent MCHAT with that high risk fail in a district that we're serving to be referred.
Okay. And can someone who works in a practice who does the MCHAT, and if someone fails the MCHAT in their practice, can they refer directly to Babies Can't Wait for this program with that failed MCHAT?
So they can refer to Babies Can't Wait. Again, they have to be, and again, someone else can, they have to be enrolled in Babies
Right.
Can't Wait. So they can refer, they can say, look, I'm aware of this, hopefully given, but Babies Can't Wait is going to have to do their evaluation and onboard them. And that is also to make sure that once they go through this pilot, if there is a cost, Babies Can't Wait will cover that cost. So if they're not enrolled in Babies Can't Wait can't be the payer of last resort. It's also to make sure that they have this support after, that they're not just coming for an evaluation, they're coming for this. I mean, you've heard Marlene and April and Kyra, the support they provide is way more than what I'm putting, a label on what they've already identified. Again, nothing wrong with their child. They're learning differently and they've already identified that. We're just helping open some doors up that they're going to continue. So yes, they can in a way, I guess, but they're going to be a part of Babies Can't Wait first and foremost before they come to us.
Okay. And I just wanted to say, I really appreciated the information from the Babies Can't Wait coordinators about kind of what they do with the MCHAT. I mean, I think giving it to a family to look at and repeat it in themselves is just a great idea, and one I've never even thought about doing. So I appreciate that input. I think that would be a great way to really help families understand what's happening, instead of just, I get a lot of families that just say, oh yeah, my doctor said I failed this and I don't even know what it was, type of thing. So really keeping them involved and active participants in this whole process, I think, is just terrific. And I thank you all for giving us your time to do this webinar, especially those that have young kids at home, especially during dinner time. So, we appreciate it. This video will be available on our website, and we will let everyone know. And then we will send out any information you all want us to send out to everyone who registered for this. So thank you all so much for participating.
Thank you. Thank you to everyone for sharing on the panel, and thank you for welcoming us today. It's a pleasure to share kind of what we've been doing. So
Yes.
Thank you.
This is exciting to see how much it's grown since I've left Emory, as being one of the first people to start with it. And, it's really great seeing Allison or Dr. Schwartz take this project and really go statewide with it. It is just excellent. And thank you, Sunita, for keeping the support going for it.